Graham Pryor, welcome to eHealth Space.
Thank you.
Tell us a little bit about what eHealth means to you.
Primarily, eHealth means it's really an evolution, not a revolution, and it has substantial benefits to improve quality and safety of care that we deliver to our residents and our clients today and well into the future. So there's clear evidence that we can deliver better care, we can evaluate care, we can plan care for all Australians well into the future and today. We've done a number of trials utilising current technologies to improve such things as pressure ulcer management and medication outcomes, and there's irrefutable evidence that eHealth will deliver better quality and safety of care today, tomorrow and into the future. The second benefit is primarily around efficiency, where we can have much more efficient and effective operations for all of our client recipients. That applies to other industries. You take retail, transport, banking services. All of these industries today are far more efficient and effective at delivering homogenous outcomes for their clients, and we can find the same outcomes for us. So two things primarily: improvement in quality and safety, and secondly, and therefore enhanced care outcomes, and secondly, we can become a much more efficient and cost-effective industry for our society well into the future.
You're Chief Executive of Hall & Pryor. You mentioned that you've got about 1,400 aged care residents.
Yes.
in your residential facilities. Is that correct?
That's correct, yes.
Okay. Does eHealth also mean that it gives people the opportunity to self-care or self-manage in their own homes for longer?
This is the second. This is a macro issue, much more. This is a big picture macro issue. Today we have about 800,000 Australians who receive what we call formal care. 600,000 of those are at their home, and 200,000 of those residents are in residential care. Around 2040, 2050, they estimate there could be up to 5 million Australians receiving care. We don't have the workforce today, and we won't have the workforce in the future to care for 5 million Australians. It's simply impossible without a major change in our migration policies. So what will fill the gap will be, in my view, self-managed care, or what some people call co-production, where we work far more closely with the client recipients and they engage and they help manage their care outcomes with us. And part of the medium for that will be technology. For instance, you could today set up simple technologies to take your blood pressure, a whole bunch of outcomes around physiology and pathology, and that simple process can grow into the future. So we can close the gap between care needs and care provision in the workforce through technology. Yes, to answer your exact question, technology will keep people in their homes much longer and much more comfortable, and I think extend the quality of life.
Okay. Older people traditionally aren't tech savvy. I know there's always exceptions. But does that mean that the age of the population could be an impediment to the uptake of eHealth technologies?
Absolutely not. What we have found is that with our clients in care, a very large number are very comfortable with the use of technology. A lot of them grew up with technologies in a much more wider macro sense. This generation put man on the moon. This generation built nuclear submarines, power generation. This generation laid down the current technologies we run our society with today. They trust technology, and if anything, they're slightly critical as to why we haven't earlier adopted technologies for them. They know it works, and they trust it will deliver. For instance, they've all grown up with telephones in their house and in their cars and mobile phones. So why aren't we using technology? That's their big issue, I believe.
Tell me a little bit about where the rubber meets the road in terms of Hall & Pryor. How do you use eHealth technologies today?
We use a range of technologies. We've put in place a similar platform across all of our sites that's used Web2 technologies that are used for all business-to-business outcomes, resident care, resident administration, interface with in some cases with GPs, and interface with the Commonwealth authorities. That exists and is working very well. We're about to embark on a complete replacement program for all of our clinical care technologies that will lead to the adoption of an appropriate base for eHealth records for all of our clients. So we began a journey about 8 years ago to lay down the infrastructure for this, and our final segment will be a new clinical IT platform that will allow and enable an eHealth record to be in place for all of our clients by mid next year.
Graham Pryor, thank you for joining us in eHealth Space.
It's a pleasure.